Hey guys, Doc Heps here. So you've seen those commercials with all the bent vegetables talking about Peyronie's disease, and you think, well, maybe I have a problem like this. Should you get checked out? Well, watch this video and we'll give you the scoop. Hey guys, Doc Heps here. So the question we're going to go over is, so you think you may have a crooked, bent penis, maybe Peyronie's disease. What's the deal? Well, we're going to go over what Peyronie's disease is, some of the symptoms, diagnosis, and treatment options. So let's start. Peyronie's disease. It's a condition where the penis is curved or bent. It's usually associated with two phases. The first phase is called the acute phase, where you have some pain. This may be bent or not bent at that time, but over time, the penis may bend. That pain gets better. And typically, we just wait it out as urologists because we oftentimes don't do anything aggressive during the acute phase, and that can take up to 6 months to resolve. Over the next 6 to 12 months, you may see certain changes. The penis may bend, it may not, but in some folks, they can have a pretty significant degree of curvature. It can curve in any direction, down, up, left, right. Everybody's a little bit different. Some men, it can be a problem. It can cause them to have sexual difficulties, and it can be a problem for their quality of life and their relationship. And they come into the urologist and they're wondering, what the heck's going on? What can I do? Well, let me tell you a little bit what we think's going on. Nobody knows for sure. But the theory is that there's either so-called microtrauma to the penis, or there can be an acute trauma to the penis that causes some inflammation. And this inflammation causes fibrosis and scarring into the lining of the penis that holds the blood. And this fibrosis and inflammation initially causes pain, but then scars in and causes the penis to curve during erection. What can be done? Well, there's different treatment options, and I'm going to go over that shortly. Typically, first, we'll diagnose it by doing a history and physical. Oftentimes, we'll feel what's called a plaque, which is a hardened area in that lining of the penis that I talked about. If you do have curvature, sometimes a urologist will try and document that curvature by giving you artificial erection in the office, and that will help measure how much curvature you have and how provide some guidance as to whether the treatment is improving your symptoms. If you feel a plaque and there's a significant curvature that's bothersome, then the urologist oftentimes will offer you some treatment options. The most common treatment that we're doing these days is something called Xiaflex, which is breaks down the fibrosis and scarring that occurs in that penis, in that plaque. So men who have significant curvature and who have a plaque are candidates for this Xiaflex. So Xiaflex is basically injected into that plaque. It entails a total of 8 injections. So you would get the injection first, and then an injection a few days later, and then 6 weeks after that, you undergo another 2 injections. And then you do that for a total of 4 rounds or 8 injections. Now, most guys, in my experience, will not see some benefit until at least the 2nd, 3rd, or even after the 4th injection. Usually, we will typically recommend doing what's called modeling exercises, where you wait a few weeks after the initial injections, and then you'll just stretch the penis. You also bend the penis to break down that scar tissue. So the Xiaflex can be very effective for a lot of guys, but in some men, it just doesn't do the job, and they're still struggling. That's when surgical options come in, and there's a whole variety of different surgeries, some very simple, some more elaborate. In general, it's an outpatient procedure. The potential problems, although rare, are erectile problems, erectile dysfunction, some numbness, tingling, shortening of the penis with surgery. But ultimately, we do this procedure in men who have significant curvature. Xiaflex doesn't work, and they're just want to be normal, and they're willing to take the potential small but real risk. So Peyronie's disease is a common problem. Some of the options are just do nothing if it's not any issues. Some men come in and they just want reassurance. They feel that plaque and maybe they have a little bit of curvature, but it's no big deal. We just say, hey, Don't worry about it unless it gets worse or a problem. Otherwise, we'll tell them to do those modeling exercises, even without the medicine or Xiaflex. Another option is do the combination of the Xiaflex injection plus the modeling. If that doesn't work, then we talk about surgery. So hopefully this provided you some insight and guidance as to what Peyronie's disease is, how we approach it, the exam, diagnosis, and some of the options for treatment. Check out our other videos. I think they're really insightful and may help you better understand your body. Thanks again for watching.